Hello, and welcome to Aspire Vision, the channel where we explore the latest developments in science, technology, health, space, and personal growth. In this video, we are going to talk about a new outbreak of Nipah virus, a deadly disease that has emerged in India and poses a potential pandemic threat. We will discuss what Nipah virus is, how it spreads, what are its symptoms and prevention measures, and what are the current efforts to develop a vaccine against it. So stay tuned and don't forget to subscribe to our channel and hit the bell icon to get notified of our future videos. What is Nipah virus? Nipah virus is a zoonotic virus, meaning that it can be transmitted from animals to humans. It belongs to a family of viruses called Paramyxoviridae, which also includes measles, mumps, and respiratory syncytial virus. The natural host of Nipah virus is fruit bats of the genus Pteropus, also known as flying foxes. These bats can carry the virus without showing any signs of illness and can shed it in their saliva, urine, and feces. How does Nipah virus spread? Nipah virus can spread in several ways. From animals to humans, people can get infected by coming into contact with sick or dead animals that are infected with Nipah virus, such as pigs, horses, or dogs. They can also get infected by consuming fruits or fruit products that are contaminated with bat secretions. From humans to humans, people can get infected by having close contact with someone who is infected with Nipah virus, such as family members, caregivers, or health workers. The virus can spread through respiratory droplets, saliva, or body fluids. From the environment to humans, people can get infected by inhaling aerosols or dust particles that contain Nipah viruses, such as from bat roosts or caves. What are the symptoms of Nipah virus infection? Nipah virus infection can cause a range of clinical presentations, from asymptomatic infection, no symptoms, to acute respiratory infection and fatal encephalitis, brain inflammation. The incubation period, the time between exposure and onset of symptoms, can vary from 4 to 14 days. The symptoms may include fever, headache, cough, sore throat, difficulty breathing, vomiting, muscle pain, drowsiness, disorientation, confusion, seizures, coma. The case fatality rate, the proportion of people who die from the disease, is estimated at 40% to 75%, depending on the strain of the virus and the quality of healthcare. Some survivors may have long-term neurological complications, such as persistent seizures or personality changes. There have also been reports of latent infections that cause symptoms much later after exposure, in some cases. How can Nipah virus infection be prevented? There is no specific treatment or vaccine available for Nipah virus infection. The main strategy for prevention is to avoid exposure to the sources of infection and to practice good hygiene and infection control measures. Some of the preventive steps include: avoid contact with sick or dead animals that may be infected with Nipah virus, especially pigs and bats. Avoid consumption of raw or partially cooked fruits or fruit products that may be contaminated with bat secretions. Washing hands frequently with soap and water or using alcohol-based hand sanitizers. Wearing protective clothing, gloves and masks when handling sick animals or people, or when visiting high-risk areas such as bat roosts or caves. Isolating and reporting suspected cases of Nipah virus infection to the local health authorities. Following standard precautions for infection prevention and control in healthcare settings, such as using personal protective equipment, disinfecting surfaces and equipment, and disposing of medical waste properly. What are the current efforts to develop a vaccine against Nipah virus? Several research groups are working on developing vaccines against Nipah virus using different platforms and approaches. Some of the promising candidates include a recombinant vaccine based on a modified version of the measles vaccine that expresses a Nipah virus protein. This vaccine has been shown to protect monkeys from lethal challenge with Nipah virus. A subunit vaccine based on a purified Nipah virus protein that induces neutralizing antibodies. This vaccine has been shown to protect hamsters from lethal challenge with Nipah virus. A DNA vaccine based on a plasmid that encodes a Nipah virus protein. This vaccine has been shown to protect mice from lethal challenge with Nipah virus. an mRNA vaccine based on a synthetic messenger RNA that encodes a Nipah virus protein. This vaccine is currently being tested in a phase 1 clinical trial in healthy volunteers to evaluate its safety and immunogenicity. These vaccines are still in the early stages of development and need further testing and evaluation before they can be approved for human use. However, they offer hope for a potential prevention strategy against Nipah virus infection in the future. Conclusion. Nipah virus is a deadly disease that has emerged in India and poses a potential pandemic threat. It can spread from animals to humans, from humans to humans, and from the environment to humans. It can cause mild to severe symptoms, including brain inflammation and death. There is no specific treatment or vaccine available for Nipah virus infection. The best way to prevent it is to avoid exposure to the sources of infection and to practice good hygiene and infection control measures. Several research groups are working on developing vaccines against Nipah virus using different platforms and approaches, but they are still in the early stages of development. We hope you enjoyed this video and learned something new. If you did, please give it a thumbs up and share it with your friends. And don't forget to subscribe to our channel and hit the bell icon to get notified of our future videos. Thank you for watching and see you next time on Aspire Vision.